Cambodia is steadily recovering from a long period of civil war and insecurity. The civil war is over and no one wants to start it again. But even as the economy moves forward, giving optimism for the future, some people are being left behind simply because at some time in their lives they have had leprosy. A disease that is difficult to catch and easy to cure, but the stigma associated with it leaves many people isolated and in poverty. In the last few years, many more children in Cambodia have completed secondary education. The transport infrastructure has improved. Fruit trees are replacing landmines in many conflict-affected areas. The garment industry has established an international reputation for the quality of its exports, and tourism is increasing. But other people, like the man we see here, remain rejected and yet hidden away by society.
Welcome to the Ciomal Leprosy Centre. This is where patients from all over Cambodia can be sent to have special care in order to treat the complications of leprosy. As you arrive, you will see that there are patients sitting here with their feet soaking in water. They are learning how to look after their damaged feet, because in leprosy the nerves are damaged so that the patient no longer feels pain, and many of them end up with chronic ulcers on their feet, exactly the same as people with diabetes get. And what we need to do is to teach them how to clean their feet, look after their ulcers, and then they will get their ulcers healed. Some of these patients will also have a muscle paralysis so that the foot no longer moves up and down at the ankle. And when they walk with a very characteristic dropped foot gait. Those we can operate on, and we can give them a foot in which they can walk down the street. Nobody realises that they've got anything wrong with their foot, and they can wear normal shoes, and hopefully they will then keep their feet for the rest of their lives. As well as the feet, we are also working on hands. And in many of the leprosy patients, the fingers become clawed. They're no longer able to bend their fingers so that they get a nice pinch. And for those, again, we can do reconstructive surgery. We have a physiotherapy team here to teach the patients to exercise their own hands, to get them mobile so that they can use them. And then we do reconstructive surgery to give them back functioning hands so that they are able to use them, and so they're socially acceptable, and this is even more important. And so a lot of the work that I do when I come to Ciomal is to do the rehabilitation surgery for the patients and to teach the staff all these essentials of how you look after the patients. There are many patients now who are back in their own villages, working with restored hands and feet, and quite capable of looking after themselves, and they are accepted in the society.
Leprosy is a very simple disease that is spread by a bacillus that can be ingested when you are in close contact with somebody who has the disease. So it is spread within communities by coughing and sneezing, mainly by people who spend a lot of time with each other.
This hand is before surgery. It is after exercise. It have a mobile hand. Yeah, clear. Yeah. It is hard to work because of it had trouble when they working because of the hand cannot straight and it close, so it's difficult to cut anything that he want to cut. Another thing is the trouble with a small thing. He cannot cut with a catch something, hold something with a small one, but a big one is problem. It's not big problem, but it has a problem with a small thing. Okay, and this one is another hand that after surgery, yeah, it have mobile and it's easy to cut small thing. Yeah, so it's possible for him to cut to hold a small thing or big thing. So it's completely different before the hand before surgery and after surgery. Okay. He cannot close his eye properly because of he has affected by leprosy. This cornea will be damaged of the society outside. It will make a trouble to his cornea, and it become dry because of he cannot close properly. And this one is he can close. This one is before surgery, and this one is after surgery. But yeah, and this one he cannot close. He will become blind if he no surgery because there is nothing to protect his cornea.
This young lady has been here on a number of occasions. She has virtually no hands left at all, and with that she's worn them all away. She has had some surgery which has separated the thumb out, grab me, so that now she can actually pinch on my finger, open, so, grab, and with that she can do all sorts of things which she couldn't do before because previously her hand was a little mitten. Now her face was also badly disfigured, and another surgeon has put a bone graft in her nose which has corrected the obvious deformity. So most people now, when they see her, they wouldn't comment on her face because she passes as a normal person in the street because her major leprosy deformity has been corrected. And so that's the sort of thing we're doing. She uses this hands, helps us with organising material and equipment that we're using in the operating room. Thank you.
The overall aim of the Ciomal program in Cambodia really has two principal objectives. One is to increase the number of people who are cured before they become disabled. And to do that, we do two things. We work with the Ministry of Health to improve access to diagnosis and treatment, and we help them to train undergraduate medical, nursing and physiotherapy students in how to care for people with the disease. The second thing we do is much more general public awareness campaigns to tell people the truth about leprosy and try and reduce their fear of the disease. The other main aim of our program is to provide physical and socio-economic rehabilitation services to people who are disabled as a consequence of having had leprosy, and to give them the opportunity to eventually get back to living a normal life. Yeah, some of the successes of the scheme have been people who have been able to create a small business that they can run themselves and that they can expand by themselves, diversifying into different areas of work, perhaps enlarging their business. So they are able to build on the foundations that we have provided them with. We have given them the start and they have built on it. This is a traditional Khmer song. sung by travellers to remind themselves of their roots and their desire one day to return, as all of these patients would like to do.
កំពុងចាមកំពុងចិត្តអើយរៀនសូមគីកាយការកំប្រកាយនឹងប្រចាញ់សំរង
This is Mr. Kong V. His story is typical of many. He first noticed signs of leprosy when he was 11 years old, but he did not receive any treatment until he was nearly 25. By then, he had been forced to leave his home village because the villagers were frightened of his appearance. His skin was covered with nodules and blisters, both of his hands had become clawed, and his eyes would not close properly. He was one of the first patients when our centre opened in 2000. After 9 months of treatment, he moved to a new village and, with the help of a loan from Ciomal, set up a small recycling business that takes him to nearby villages, where he has been able to make many new friends. Now, he and his wife, who he met when they were both patients at the centre, also have a successful pig rearing business, and at age 31, with 2 secure incomes, they can both look forward to a brighter future. But he still has one regret. One place he still cannot visit is his home village, despite our efforts to persuade the villagers that he is no danger to them. But we will keep trying. Some people are lucky. They will have good access to health services, so they can be diagnosed and treated and cured before there is any visible sign of the leprosy. So very often the people in their community will know nothing about it, and they can go on living their lives as usual. The problem is for the people who are not so fortunate and who do not have easy access to health services, because then they remain untreated, the disease becomes visible, and then they can experience exclusion and from their community and stigmatization, not just by the community but often by their own family and friends. Other successes have been people who have learnt new skills, people who perhaps before had no technical skills, very little opportunity to earn a good salary. But now, because of their vocational training, they are skilled work people, skilled mechanics, skilled engineers, and they can now look forward to a long career until they retire. All staff at the Ciomal Clean Kind Centre share a commitment to high standards of patient care and to treating patients with respect. Our Cambodian doctors, nurses and physiotherapists are well qualified and supported by permanent and visiting international specialists from Cuba, Australia, America and the United Kingdom. We provide 24-hour nursing care, and our housekeepers ensure that high hygiene standards are maintained and the patients are able to eat a varied and nutritious diet. The centre also has an important teaching role, and as well as giving them the knowledge and skills they need, we also try to pass on our values and standards to the undergraduate students who come here for clinical placements. At first they can be very fearful of the disease. On their first day they may be wearing masks and gloves, but the first lesson they learn is that they have nothing to fear. And as for the patients, you know, it's surprising what even a few weeks here, a few weeks of being treated like a human being again, what this can do for someone's self-esteem and self-confidence and their hopes for the future. Finally, we are pleased to record the visit to the centre today of Prince Sisawath Tomiko, who is the Principal Private Secretary to His Royal Highness Norodom Sihamoni, the King of Cambodia. He's visiting us today to meet the staff and the patients.
ចំពោះការវះកាត់ហ្នឹងមុនពេលវះកាត់គឺគាត់ได้ยืนยันកម្មវិធីគេជួយដោយសារគាត់មានការវះកាត់
អរគុណច្រើនអរគុណច្រើនសំលីអរគុណច្រើនអរគុណច្រើនហើយខ្ញុំ I would like to say how much I was impressed by the wonderful achievements of your hospital and how I am grateful for your dedication, your personal dedication and the dedication of all your staff who've been helping the Cambodian people suffering from leprosy. And please rest assured that His Majesty the King, as well as us from the royal family, will be helping in the way you would like us to help.